talk is basically just trying to summarize what Dr. Lalit Mani has just enumerated in the editorial process so that you can avoid the pitfalls when you are submitting your manuscript with respect to the style, the language, choosing the right journal, and the common mistakes that one comes across while submitting a manuscript. So as has been emphasized time and again since morning, don't rush into submitting your manuscript for publication the moment you have written it. Because what something was very relevant and very precise when you had written it, if you read it after a few days, you'll find probably it was crap and it could have been written in a better way. So carefully read and reread your manuscript, preferably at different times and at different places, so you're more relaxed, your thought process is different, and you can interpret your manuscript in another light. Try and share your manuscript with others who are in the same field. Senior colleagues who have published, have got experience, are the best people to take into confidence. Share your manuscript with them and request for feedback because they are the best critics to analyze your manuscript. Don't be complacent and sit back and relax and say that, okay, I have written my manuscript, let me just submit it to the editor and let them go through the reviewer, and whatever comments I get, then I'll amend it. Because by that time, it might be just too late. I mean, you would have a desktop rejection and you can't be resubmitting to the same journal, so you lose the bus. Ask your colleagues about the most appropriate journal with which you can interact for your manuscript submission. Now, this is something which Dr. Lalit Mani has already highlighted. I mean, you cannot be choosing a specialized journal like an arthroscopy journal for a spine article. I mean, that's a very broad categorization, but then you should know what exactly your journal is looking into. So you can ask your senior colleagues to know about which journal to submit, but there are online resources also now available where there is, for example, Elsevier runs the journal finder where if you key in the title, the abstract that you have, and the keywords, it will give you a list of journals which may be relevant to your manuscript with which you can think of submission. Another thing which I want to highlight is that when you're young, you are enthusiastic and you want results fast. So what you think is, okay, let me submit to 2 manuscripts. Whichever one accepts, I'll go with that. But that is ethically unacceptable. You cannot be submitting the same manuscript at 2 different journals. Ensure that you have read through the aims and the scope. This is again re-emphasizing what the previous talk has been about. Unless your manuscript is in accordance with the aim and the scope of the journal, it has no hope of getting the light of day. Ensure your manuscript conforms to the author guidelines, which are very clear-cut, available at all leading journals' websites. So you should go through the instruction to others and make sure your manuscript conforms to that. 1 in 5 manuscripts is reported by publishers not to follow the style and format which is required for a target journal. And that could be with respect to the figures or the tables or the references, and they go for straight away for a rejection. When you talk about figures, we've had a talk in the morning and I'm just re-emphasizing the same. It needs to be a good resolution picture that you're submitting because ultimately this is going to get printed, and if the resolution is poor, your paper and research hypothesis and everything could be excellent, but if it doesn't show up in print, then it has a poor chance of getting accepted. The number should be appropriate. You should have representative numbers. So if you have 2 series of cases which are being compared, 1 representative example from each is good enough. You don't have to give all the figures for all the patients. Also, you can make a collage as was discussed in the morning and submit if the number of figures is more. Again, the number of figures cannot exceed a level because every journal has limitations, because ultimately cost is what matters, and when it is printed, it does count towards the number of pages being printed. So that is one of the factors to keep in mind. The legends should be very concise and precise because they should convey what the figure says, and it should be brief because nobody in this age has the time to dwell on long drawn-out descriptions. When you talk about tables, they should be correctly labeled. The X and Y axis should be correctly labeled. They should not be a repetition of the text. I mean, if you have a table submitted which is a 2x2 table saying number of cases and gender, I mean, that could straight away be given by a single line that, okay, 12 female patients were seen in this study. You don't have to give a table for that. The table thus should be an appropriate one, which conveys some meaning. and it should be something which is not verbatim repetition of what has been given in your text. It should be, again, carrying a legend which is concise and precise. Coming to references, they should be recent, because if you have a study about outcome results in a TKR in 2018, you can't be quoting articles which are dated before 2000. You want recent articles, you want relevant articles. It should be articles about TKR and not about THR or custom-made prosthesis when you are talking about TKR. They should be all quoted in the text and should follow the journal guidelines. And above all, one of the things which puts off the editor or the editorial process is that people don't stick to the word limit, because if you exceed the limit, whether it's in the introduction, whether it is in the abstract, whether it's in the total extent of your manuscript, that is something which probably conveys to the editor that you are not clear of what you want to convey, because whatever you want to convey can be very precisely given in a gist. One should try and make a good first impression with the title and abstract. This has already been spoken out in the pre-lunch session. So these are incredibly important components of your manuscript. These are the first elements that your editor is going to see. So title should be catchy, should convey what you want to say, and if it can build an interest in the reader's mind, like, are chocolates going to prevent heart disease in a 60-year-old plus patient? I mean, if you make a rhetoric question like "are," maybe it evokes some interest. So the title should summarize the main theme of the article and reflect your contribution to the literature. When you talk about the abstract, make sure it introduces the topic. It shows what the gap in the current literature is. Your method should be very clear. You should be mentioning your observations and discuss them in brief, and offer a brief conclusion in the end. Remember, the key characteristic of scientific writing is clarity. You have to professionally edit, not just proofread, but professionally edit your manuscript, which includes the main text, the list of references, the tables, and the figures. Up to 50% of articles by Elsevier has been reported to have been rejected even before they reach the review stage. Why? Because of poor language. Poor language makes it sloppy. It makes it confusing. It makes it boring for you to read. Don't use long, complex sentences. It's not an English grammar test that you're giving. This is not essay writing. Your manuscript is ultimately going to go into publication and is going to be read by people who are non-English native, and it needs to be simple, it needs to be comprehensible so that everyone can understand what you're trying to communicate. So properly written, edited, and presented text will be error-free, understandable, and will project a professional image, which will help to ensure that your work is taken seriously. You can use proofreading, you can use online means like spelling and grammar checkers available online. A word about cover letter. I mean, it gives an authors important opportunity to convince editors that your research is actually worthwhile. So when you write a cover letter, outline the main theme of your paper, argue about the novelty of your paper, and justify the relevance of the manuscript to the target journal. I mean, one more manuscript about TKR, why do you want to publish? So you need to convey that to the editor in your cover letter. I won't go into what you should be doing with the reviewer comments, but you should address the reviewer comments very carefully once they come back. That's one of the subsequent talks. So just to summarize, the common mistakes that you commit, it should not be a copy and paste from previously published data. So it should not be a plagiarism. You should not be republishing articles or part of articles. Using text or images without permission from previously published data is unacceptable. This is plagiarism, so you should not be doing that. Your manuscript, once you are ready and submitting it, should be complete. It should have your abstract. It shouldn't be missing an abstract or a conclusion. I mean, you should have a complete manuscript. Poor language is a no-no. I mean, you have to improve, whether you know it or you ask help from your colleagues to get the language improved. The figures should be appropriate in number and they should be clear, of good resolution, so they are printable. The legends for tables as well as figures should be clear, concise, and precise. Your references need to be complete and they should not be obsolete. So this is just an overview of what common mistakes you commit. If you go into the detailed text of what you are actually submitting as in the scientific content, it should conform to it should not, the reason for rejection is that probably it does not conform to the recognized procedures or methodology which can be repeated. Maybe the analysis, statistical analysis you used is not appropriate. The arguments that you've used in your discussion may be illogical, unstructured, or invalid. And whatever observations you have, that data does not support the conclusion that you're drawing in the end. Your conclusion may not be commensurate with what the review of literature or current practice is. So it should not be that your conclusions ignore the review of literature. Also, one of the reasons for rejection is something what is called a salami slicing. I mean, if you have a patient, for example, a study on a pot spine, and you're looking at long-term results, if you publish with the same journal, you submit 2 manuscripts, one saying neurological outcome in the same patient group, another saying radiological outcomes in the same patient group. That's called salami slicing. This could be combined and put it as one. So if you are salami slicing, probably it will be an outright rejection. So to conclude, given the ever-increasing number of manuscripts which are being submitted for publication now, the process of a manuscript, preparing a manuscript well enough to have it accepted by a journal can be daunting. Less than 10% of manuscripts submitted are accepted by high-impact journals. The number may be up to 40% if it's a special issue. And you may have to resign yourself to having your articles rejected more than once and reworking them to submit them to a different journal before they can be accepted. Thank you.